I love it when people talk less and put in more action. And that is just what we've seen. Recently, I posted a video about the ongoing strike and conflict issue in the Tamale Teaching Hospital regarding the death of one patient who was brought into the hospital and was not properly taken care of and have to lose his life. If you've not watched that video, you can watch it in the description below. The link is there. So prior to that meeting, the minister was made to understand that some basic equipment was lacking at the hospital. And even in my presentation, I tried to project it in such a way that, okay, the health workers do their part, but without the equipment, they can't work. And I try to like share the blame equally between the government and then the health workers. But shocking after that evening, like the day it happened, the next day, the minister provided some equipment to show that he's not just talking, but he's actually passionate about what he's doing and the lives of people really matter to him. So I'll be watching a video of him sending the equipment and some of the things he says so that after that we'll come back for a discussion.
For the past 2-3 days, I have been speaking to stakeholders in this sector. And please, it isn't everything we can put out there as leaders. I am prepared for us to come around the table and discuss whatever we need to discuss. And so my humble appeal to my wonderful medical doctors and health professionals at Tamale Teaching Hospital is that I am the first person to take care of your interest. And therefore, let's call off the strike and let's all regroup and strategize going forward. There are some of the things we can easily do with our internally generated funds. Please, let's confront the issues out there. It is just not sustainable for government to keep donating equipment to health facilities, and at the end of the day, when the equipment are obsolete, we run back to government for money to either maintain or to replace this equipment. Once at least, even if we are not charging the requisite fees, we generate something small out of these machines. What happens to the money? There must be a new direction. And we all group together and think through it. Maybe I'm looking at it from a different direction. We'll share ideas. Let's pursue the interests of the ordinary Ghanaian. I thank you.
Simple, he has delivered. And I think that is how matters of emergency are supposed to be handled, because that was about life and he came in so promptly to address their needs, which was the shortage of resources. And they also mentioned to him that the hospital was facing some water crisis and power outages. And right then now, his students said he was going to speak with the necessary authorities to make sure that those things are resolved. So I think right now the doctors and general workers of Tamale Teaching Hospital are going to be happy, and then they will not have any reason to complain that, okay, we lack this and that was why this happened. So this is Gifted Media English. Don't always forget to click on the notification button for update on our videos that are being posted. And if you've not subscribed, please make sure you do so for us. And thank you so much for joining us this evening. We'll see you in subsequent stories. Thank you.